I'm joined now by Caroline Hacker, who's the head of mental health policy at the Care Quality Commission. Good evening, Caroline. Thanks for coming in. As Simon said there, the politicians have long talked about this. The Conservatives have talked about solving it. Are they?
Well, a lot of work is going on at a local level with local crisis concordats in place across the country, which is where local partners such as the police, GPs, come together to deliver action plans to improve local crisis care in their area, which is really down to commissioners to make sure that the services that are in place for those experiencing a crisis meet their needs.
So some just aren't getting it right, and therefore this crisis in crisis care is happening. Is there a motivation for some of these commissioners to get this sharing, as we heard there, is so vitally important, get that off the ground?
Absolutely. The current situation is unfair, it's unacceptable, and it's fundamentally unsafe. People experiencing a crisis are finding it really difficult to access the right type of care. They often experience a crisis such as feeling suicidal or paranoid or self-harming in the middle of the night, and they're not getting access at that time. If they do turn up at services such as A&E, they're often met by staff that don't treat them with compassion and dignity and respect.
And again, we heard in the piece then, this is something that's borne out by the report, that if they turn up with a physical problem, a heart attack, for example, the A&E staff click into action, they know what to do. In fairness to them, though, is it harder to quantify when someone has got a mental health problem when they're having a crisis?
Well, the important thing is if somebody is turning up at A&E with a mental health crisis, that staff really work with them to understand what's happening. They treat those people with respect and dignity.
What if they're difficult, they're abusive, that kind of thing?
It can be challenging, but it's really important that these people are having a crisis. This could fundamentally, in extreme cases, end up with someone committing suicide. So it's important that staff have the training to understand how to deal with these people turning up having a crisis situation.
You have found some good examples. Give us some of the very best ones of the system working.
Absolutely. So, as I mentioned with the local crisis concordats, we found areas where partners are coming together. So that's where the police are coming together. They're working with volunteers and charities. In our report, we found that a lot of patients find the services they get from charities and the police much better than they do at A&E. And it's important that commissioners work really closely with these groups, and it's down to commissioners to get this right.
Finally, Caroline, I'd imagine that not having prejudice on the part of these people, whether they're police officers or healthcare professionals or others dealing with it, but being open-minded when they're met with someone having this kind of crisis has to be key.
Absolutely. For many, many years and still today, there's a real stigma around mental health. And it's really important that those people that are at the front line have the right training and they have the right attitude for treating with these people. They're having a crisis. And if you met someone who was having a physical health crisis, like a heart attack or a stroke, or who had been in a car crash, they wouldn't be met with the same sort of attitude as people having a mental health crisis often are.
OK, Caroline, thanks very much indeed for joining us.
Thank you.